People need to know that HPV is a virus that is the most pervasive virus out there that, 90% of us have, and we get it from doing nothing wrong. It is a skin to skin virus, and they need to be aware that most likely they're walking around with it, especially people that are, um, you know, in their 40s, 50s, and up who weren't you couldn't get the vaccine because it wasn't available till 2006. Every woman, when she goes to the GYN, should be getting the co-test, which is a test for HPV, and it is also done via the PAP, and they should be getting the results. When somebody's diagnosed with abnormal cells, there's a percentage, and I don't know what it is off the top of my head, that it is HPV. A lot of times the GYN will say you have abnormal cells and won't say you have HPV. But it's probably a good idea that the doctor states exactly, what it is, so you can make the connection between HPV and what you have. I suggest that they, when you're younger, and you're diagnosed with HPV, it's a lot different than when you're older because your immune system is better. And the way the virus works is that it lays dormant in your body, it burrows, and then later on in life, if your immune system is down for whatever reason, it can cause one of the six cancers. For someone young that's been diagnosed with HPV, I would say continue to go for your PAP slash co-test, HPV test every year. Stay on top of it. Pay attention to your body if you feel something's wrong, or there's blood or any type of something like that. Then see your doctor. There are outliers of some young people that end up with HPV related cancer, but it's mostly the older folks. For an older person above 40, 45, mostly in the 50s and 60s range, if they are diagnosed with HPV, I would pay attention to the head, neck, and throat area, as well as anal area, because those are the areas that are that are on the rise. And just FYI, in the anal area, an anal cancer is often mistaken for a hemorrhoid. So that's what it presents like. It presents like you have a hemorrhoid with bleeding and itching. So you need to really check that out. Follow up to an abnormal PAP is a colposcopy, where you go back to your GYN and they do a more specific look at the cells. They send it out, and they get the lab work back. So that's really important. It used to be up to age 26, but now it's to age 45. And the truth is you can get it, to whatever age you want. You have to pay for it after age 26, but just know that as you get older, your immune system is not what it used to be. And there's no data on, what it does in terms of if it protects against other strains down the road. However, I myself at age 53, I did get the vaccine because I thought maybe it would protect me against strains that I don't have. It's really important that women arm themselves with knowledge before seeing their GYN, because I'm on the front lines and I speak to people every single day. And 90% of the women that I speak to have no idea that they're supposed to be getting a digital rectal exam. That's the doctor should be using their finger and giving you a rectal exam, because that is part of a full pelvic exam. And unfortunately, there's stigma. Some doctors are doing it, some doctors aren't doing it. I've spoken to women all around the country and around the world that have never heard of it, which is astounding to me because that whole area down there, it's a whole breeding ground for HPV, and HPV travels. So if you have it in your vagina, why can't you get it, in the anal area? So I would say number one, make sure that you're going to a GYN that does do a rectal exam, and if they don't, and they dismiss you, find somebody that does. Um, I can go on and on about responses I've heard from women why their doctors aren't giving it to them, which is really unfortunate. A lot of times you're going to get dismissed. So, for example, in my case, I had seen my GYN for many, many years, and she did do a rectal exam. I went to see her and I told her that I have some blood. It's not a lot, but it's consistent. It feels like a hemorrhoid. She did do a rectal exam and she said I was fine. And I said, I'm not fine. And I went to someone else and I caught it and they caught it and it was stage 2. It's too bad there's a stigma. There used to be a time when you didn't say breast cancer. HPV virus, the comedian Ali Wong once said, if you don't have HPV, you need to get a life. Everybody has it. Almost everybody has it. If not, they're going to get it. Um, there should be no shame. It's a skin to skin virus. You don't even have to actually have sex to get it. And if you did get it from sex, um, you're just being human. So it's too bad, that there's a stigma. And regarding the cancers, yeah, that's unfortunately another stigma. I remember having cancer along with my co-founder Marsha Cross, and she said, wow, I have cancer, and that's not bad enough. And now I'm being made to feel bad because of the type of cancer it is. So yeah,
Yeah,
it would be great to get rid of those stigmas. We just have to talk
absolutely.
about it to normalize it. We have to talk about it. I do know plenty of women that have gotten anal cancer as an example, and they want to call it stomach cancer or colon cancer. And I always tell them, please say what it is. It's the only way we're going to normalize it. Thanks for asking. So, our organization is called HPV Cancers Alliance, and we started in 2020. Although it feels like it feels like 10 years. I started it because I felt that when I was diagnosed, there's it's almost like nobody knows anything about this. I mean, it's very, very few. If you talk to people, a mother who's had 3 kids has no idea why she's going for a pap test. Somebody else doesn't know, about the HPV vaccine, or if their kids got it, or there's a lot of confusion, and misinformation and wrong information about HPV. And I thought, wow, there's some really big gaps here. And then you put in the stigma, and I thought, wow, this is something I think we could, bring attention to this. And imagine, like when I was going through it, I almost felt like I found this amazing dress on sale and I had to tell everybody about it. Like I thought, oh, you know what? We can do this. We can spread knowledge and save lives just by talking to people about this. And so that's why we started the organization. We do speak to patients every day, especially Marsha Cross and I. So here's a couple of questions. We'll get questions from, oh my God, I have HPV. And I'm like, okay, welcome to the club. We all have it. Don't panic. To um, I'm stage 3. Uh, what do you suggest in terms of which hospital I should look at, what kind of treatment, and these kind of things. Um, and questions like, here's one of my favorites, although not really. Oh, I was just diagnosed with an HPV related cancer, but I'm thinking I'm just going to go to the drugstore and I'm just going to take some vitamins, and instead of going for the traditional treatment that my doctor told me. You know what? nobody signed up for this cancer. Nobody. But honestly, yes, I believe in complementary and beefing up your immune system. But if you have cancer, you better go listen to that MD. I know for myself, I want to get rid of it, like get it out. And then you can do all your complementary, all your carrot juice, everything you want after. But get rid of the cancer. You don't want to walk around with it. My parting words are that if you feel something, something off, don't dismiss it. See the doctor. If your doctor dismisses it, get a second, get a third opinion, because you know your body more than anybody else.